Okay, this is part 3 of quotes on Thomas Szasz. He says, a person who suffers from and complains about their own behavior is typically classified as neurotic if their behavior annoys themselves. If their behavior annoys other people, they're usually classified as psychotic. Keeping another person waiting is a basic tactic for defining him as inferior and oneself as superior. Self-respect is to the soul as oxygen is to the body. Deprive a person of oxygen and you kill his body. Deprive him of self-respect and you kill his spirit. Traditionally, men have used power to gain sex, and women have used sex to gain power. In the past, men created witches. Now they call them mental patients. Now they create mental patients. Psychiatry belongs in the same category as astrology or pseudoscience. Saying a patient has a mental illness is similar to saying they are possessed by the devil. Giving a child psychiatric medications is not treatment, it is poisoning. Child psychiatry should be abolished. Yeah, if it wasn't profitable, nobody would be giving amphetamines to children. It's insane. And he talks about seeing a patient. This is now when he's teaching a class of students, like medical students, and he says, here's a lady and she has an illness that's called depression. Does she have depression, or is she just a lady with a lot of problems and troubles that make her unhappy? So he writes that on the board, depression, underneath that, unhappy human being. And then Dr. Szasz turns and faces the class and he says, does the psychiatric term say more than the descriptive phrase? Does it do anything other than turn the person with problems into a patient with a sickness? Seemingly technical terms used to identify psychological illness and treatments are simply dysphemisms, words that are unnecessarily negative, meaning the diagnostic label, and euphemisms, meaning words that are unnecessarily gentle or positive. Because the psychiatric treatments, none of them work. They all cause lobotomy. Antipsychotics cause it fast. The other drugs cause it more slowly, but they all cause brain damage. Okay, the next quote from Thomas Szasz. The crucial issue is whether the psychiatrist is to be considered the agent of the patient or of someone else. Is he a doctor or is he a warden of a hospital or of a prison? Inasmuch as the patients cannot leave at all at will, psychiatry is institutionalized scientism. Okay, that's it for today. Hope you found it helpful.